that switch, that good nerves before the performance. I'm going on the stage, I'm supposed to go and perform, that good nerves. But imagine you go on the stage and, your anxiety takes over and you forget all your lines. It can be quite crazy.
Say you're sitting at the wrong gate at the airport for a flight, and suddenly you don't get any message, and then you realize that your flight gate is changed and you have to rush. You can feel a little anxious. So it's very normal to feel anxious. It's a normal emotion. What is anxiety? Primarily, anxiety is a feeling of fear, dread, worry about anything. It could be specific, that is about some situations. So some people feel anxious when they're in a lift, some people feel anxious when they're in an interview, some people feel anxious when they're alone in a bathroom, a public bathroom, they feel alone, they feel anxious in the dark. So it may vary. And you have and the symptoms of anxiety primarily are that you feel scared, you feel worried, and exactly like you described, sweating palms, you tremble, you get nervous, your stomach churns, your head spins, you begin to feel something is going to happen, you feel I'm going to pass out, and that kind of a worry is what comes in. And anxiety is derived from the Latin word which is angst, A-N-G-S-T, that is to worry. So that's how the word anxiety comes in. So that is what I would say is my basic explanation for anxiety. And it differs from depression, because in depression you feel sad, you feel low, you feel like crying, you feel upset, you don't feel like working, you don't feel like focusing, and you feel life is not worth living, you feel hopeless, helpless. Whereas in anxiety also you may feel helpless, but you don't feel sad, you feel more scared, more worried. And it's a very, I would say, difficult situation, because you feel very uncomfortable in it. There are people who are depressed and continue working. So it's not as uncomfortable as being anxious. When you're anxious, you're in a very difficult situation because your heart is pounding, your hands are trembling, you really don't know what to do.
So my experience of 25 years of sitting with myself, dealing with myself and dealing with people, this is the only thing that I've seen really working to shift an emotion, not just to suppress it and block it, but to transform it. And this I've really experienced in the 4 or 5 years. I've discovered that very simple thing of learning to embrace the emotion instead of being afraid of it.
Very important is that you first sit them down and talk to them and tell them that I think you have a problem. I think it's an anxiety problem. What is the reason that you're getting anxious? Try and find out, the root cause. Try to find out whether it's an anxiety which is their own creation, whether there's a factor above and beyond their control, whether there are environmental factors, whether there are personal factors, whether there are genetic factors, whether there are expectations which are too much from their end, whether there are one-sided thought processes which are causing this. If you can talk to them, help them allay those anxieties and work, fine. If you can't, then you probably need to take them to a counselor, a psychologist, or a psychiatrist and have them checked up, because you don't want this to become a disorder that becomes difficult to treat.
As a mother today, I exhibit anxious behavior to my child. Is my child soaking into in her adult life?
Yes. I always tell parents that your emotions are like a sponge that absorbs water. The child is a sponge. It will absorb your emotions. So it's very, very important that anxious mothers give rise to anxious children. It does happen. And depressed mothers give rise to depressed children. It's a very well-known fact, because that's the model they follow.
Overthinking, there was a question raised about this. The overthinking is because all our energy goes in our head. Because we are scared, so we think, and all the energy is coming there. But every fighter, I've touched the martial arts also, the Qigong, they constantly bring the breath and the energy in the lower belly, and the mind is clear. Because they need to face the energy, not to think about it. So relaxing the breath then takes you to a place where it feels damn good to breathe. Because it feels damn good to be alive just now. And immediately anxiety is shifting because it feels good. In the moment it feels good. Because a lot of anxiety is born of thinking of past, future. And then I come back to my breath in the moment. I'm right here, I'm breathing. Ooh, what a beautiful experience.
Talking helps. Okay, you'll always get two types of advice, some which you like and some what you don't like. So what you don't like, don't take up. Take up what you like. You never know. I always tell patients also, if I as a doctor suggest 10 things, you may probably like only 5. Okay, follow that 5. I mean, you'll see some difference. It may not happen that you'll ever be able to follow all 10. So it's important.
The anxiety, the wetness and the sweatiness of my hand, and I was the churning of my stomach. I used to constantly fear that, am I being good enough? Am I doing my job, or am I doing, even when the guests are coming, am I being the best out there? So while trying to be the best, I developed this anxiety, and it was so bad that it went to my sudden burst of not being able to manage my emotions. Even after my kids were born, I was everywhere.
Now there are 3 terms: curious, anxious, and anxiety. So how would you differentiate between the curious mind and the anxious mind?
The person in curiousness you investigate and learn. In anxiety you can't learn anything.
Okay.
Same time, there are these peak moments when you taking help and not letting it just be in your system can help you in a long run. Otherwise, there is severe burnout, there is impact on many other things, there is impact on your relationships, and especially people who take care of you, whether it's spouse or family or parents. There is a lot of impact. So please don't delay from a perspective of reaching out for help if none of these other techniques are working. So that's one of the key things that we keep talking and sharing about.